Welcome to RHS Inside News. Today, January 31st, 2012, Gary Kotz, RHS CEO and President, proudly announced the successful implementation and partnership of the most advanced critical care telemedicine program available, Advanced ICU Care, the nation's largest independent provider of tele-ICU services. Dr. Kevin Ruggles, Senior Vice President of Medical and Clinical Affairs, explained a little bit about the history of telemedicine and what this will provide to patients at Rockford Health System.
Telemedicine is simultaneous video and voice communication to a remote setting from a caregiver who may have expertise that isn't present or complements that expertise that is present locally where the patient is. For example, 15 years ago, as part of my neurology practice, I did sleep medicine, and I would see patients initially, get to know them, and if they became long-term patients of mine and they lived maybe 100 miles from my home clinic, I would do follow-up visits with telemedicine. So it was convenient, less expensive, and it gave expertise of my specialty to that patient near their home than they would otherwise have it. Telemedicine in the ICU has developed more recently, and many studies have been done to show the advantage of this. Suggestions have been made actually that any ICU in a community hospital of greater than 10 beds should consider putting telemedicine or telemedicine for ICU into their system.
Dr. Roy, a pulmonologist and critical care intensivist at Rockford Health System, described the quality of care the Advanced ICU telemedicine will bring to RHS.
As a physician who is caring for these patients in the critical care, what do I see? What benefits do I see? And I think I have kind of just come up with few that I kind of thought about this morning when I was writing this up. Work in collaboration with the tele-ICU in the situation where I'm tied up with some emergencies. Work cohesively with the Advanced ICU to obtain severity-based quality and outcome data in our ICU, standardize evidence-based protocols, and implement best practice guidelines in our ICU. I think that is really very important to improve the outcome on these critically ill patients. Continue to improve the length of stay, therefore opening up more room for the patients who need to be in the ICU. Minimize complications by prompt treatment to these patients, minimizing complications, improve mortality, and of course, in turn, cost of care to our patients in ICU. The last thing is really sharing responsibilities at night with telemedicine, and therefore really reducing stress on on-call physicians so they are available next day for providing the care, procedures, what needs to be done, family conferences, things like that. So I think this is, again, as I said, this is addition to what we are doing, which is an excellent intensivist program. We are adding another layer of a safety and to improve the quality to our patient care.
Marcia Donaldson, a critical care educator, provided a demonstration with one of the St. Louis-based Advanced ICU Care telemedicine physicians.
This alert button is for emergencies, and the nurses can come over, press it. That sound then is going off in St. Louis, and the physician comes on screen within 60 seconds.
We work for multiple different hospitals, so we have contracts with several hospitals, and the physicians are 24/7, so we have coverage for all of these hospitals 24 hours a day.
The view from Advanced ICU is directly at the bed, so we have all of our IV pumps facing them, so when they come in, they can look to see what all of our IV rates are at. And they can look at each therapy that's being delivered to the patient.
And then also what we have, I think I can show you this, is these are waveforms. So the bedside monitor that you see in the room there, we have access to these waveforms, and we can blow them up and so on for each individual patient. So if a patient develops some sort of a heart rhythm problem or oxygen problem and so on, we can get the information that's on the bedside monitor just as you would at the bedside.
Rockford Memorial is the first hospital in the Rock River Valley to partner with Advanced ICU Care. Thank you for watching RHS Inside News.